was developing a breakthrough concussion drug I thought would help others. And I'm sure you'll understand why it's too late for me, because I've recently been diagnosed with Parkinson's.
That was today. The Hall of Famer Brett Favre telling a congressional committee that he has Parkinson's disease, disclosing that news while testifying before the House committee that's investigating a welfare scheme. Favre is accused of improperly funneling tens of millions of dollars in federal money meant to be used to help needy families instead towards his alma mater, Southern Miss University. Favre's Parkinson's diagnosis made headlines today, so we want to find out more about the disease with our 9 News medical expert, Dr. Payal Kohli. So when we talk about Parkinson's disease, Brett Favre is in his early to mid-50s, right? It's an age where you may see Parkinson's, but that's early.
It is a little early. In fact, if it comes on before 50, it's called early onset Parkinson's disease. But you know, what's interesting, Tom and Kim, is we're seeing a rise in the number of Parkinson's cases that are being diagnosed lately. Now, it's been around for 200 years. It was James Parkinson that described it, called it the shaking palsy, because that tremor is really the hallmark of it. But the question of why are we seeing more cases of Parkinson's? Is it just that we're getting better at diagnosing, or more concerning, are there environmental toxins, head trauma, heavy metals, pesticides, things that we are doing in our lifestyle that may make us higher risk for developing Parkinson's?
Well, I mean, we all think of the well-known names. I mean, Michael J. Fox's, Muhammad Ali, Alan Alda. I mean, a lot of really famous people have been diagnosed with Parkinson's disease, but many of us have friends and family as well. What is that first early sign, and doesn't matter if you catch it really early?
You know, it's interesting. It can look different for every person. For most people, it'll be a symptom on one side of the body, so it's staged. And early stages, it's just one side of the body. Usually involves that pill rolling tremor, almost like you're rolling a little pill in your hand, and then it can progress. But for some patients, I've had patients in my office who come in with their blood pressure going down. So the nervous system, which is part of our nerves, freaking out as a manifestation of Parkinson's. For some people, they'll have trouble with speech or swallowing. They'll have problems with their balance or their posture, or they'll have this very classic shuffling gait. In fact, President Biden once, when he was coming out of Air Force One, there was a question raised whether he was walking with short little shuffling steps, whether that could look like Parkinson's. Now, Parkinson's is a specific disease, but Parkinsonism is like an umbrella term for other things that can look like Parkinson's, even things that can be caused by medications, in fact, side effects.
You mentioned head trauma, and you talk about a football player. You talk about a football player who played a lot of football. He never sat. He was out there all the time. You and I had a conversation about CTE not really being diagnosable until someone has passed, until someone is dead. Is there concern that Parkinson's, CTE, these are related?
Very much so. In fact, there's this kind of overlapping Venn diagram. So is it Parkinson's, which is a kind of degeneration just of the dopamine neurons, or is it a more complete clinical phenomenon of CTE caused by recurrent head trauma, which can look like Parkinson's, because many of the symptoms are the same, and that's only diagnosed at autopsy. And certainly that could affect the treatment and the management, although at the end of the day, many of those movement symptoms are managed with the same types of medications, these dopamine medicines that give you back the dopamine. But I do want to ask the question, could this be CTE? And in fact, there's a new study that just came out in JAMA Neurology that says self-reported, 1 in 3 pro football players think they have CTE.
If there were an org chart, would CTE be above Parkinson's? Parkinson's would fall into CTE, or would CTE fall under Parkinson's, or are they separate?
So I would say it's an umbrella that's Parkinsonism, and that can be true Parkinson's, that can be drugs that cause Parkinson's-like symptoms, or that could be something like CTE, which can have symptoms that mimic Parkinson's. So it's not really Parkinson's, but it's sort of very much related.
So much we need to learn about CTE for sure, but also when you talk about Parkinson's, there's not really a cure, right? The medications, have they improved in treatment? Have they made progress?
We're getting better at slowing down the decline, and we're getting better at treating the symptoms. And, you know, obviously we're using medications, oral pills, we're treating some of the blood pressure effects, some of the other side effects. But what I find really fascinating are these deep brain stimulators. Tom and I were talking about these a few minutes ago, where if the neurotransmitter, if the communication channels in the brain are not working, you put a little electrode into that area, and you have like a little pacemaker thing that sits under your skin, and it triggers these impulses. So it can almost make up for the fact that your brain channels aren't talking to each other. And that has shown to have a lot of success in treating patients' symptoms. Again, not necessarily curing the disease, but at least helping the decline. But I still think we need to think about root causes. What are we getting exposed to that is increasing our risk of developing Parkinson's?
Well, that's the thing. There's so much we don't know, unfortunately. And despite, you think of all the money that's been raised by people like Davis Finney and by Michael J. Fox and the
Yes.
others that have raised millions and billions of dollars for research, there is progress, but we still seem to be guessing as to what's the best way to go forward with Parkinson's. So this will bring it back into the limelight or the spotlight again. So we'll keep an eye out for that. Dr. Payal Kohli, good to see you. Thank you.
Don't forget, you can always find more with Dr. Kohli at 9news.com/Dr. Kohli.